This is a revision case. We removed all old grafts such as columnar strut graft. So this is the patient's medial crura. This is the lateral cruras. And I want to show you something important. What is that? What is the soft tissue over the lateral crus? I dissected it before, and look at what is that. I will remove it. What is that? This is the fibrosis tissue, healing tissues. Look at all the cartilage covered with this unwanted soft tissue, and because of this soft tissue, the nose lose the definition. So, and the other side, I dissected it also before, and look at, this is the lateral crura of the alar cartilage, and this is the fibrosis tissue. We don't want to see too much fibrosis tissue. This is normal, this is healing tissues. But on this patient, it's too much. Because of that, patient's nose lose all the tip definition. So we removed it, and also this is the supratip area, lots of fibrous tissue here. We will remove it also, and we will give her again definition and preventing to again occur to fibrosis tissue. We will wash the skeleton, new skeleton, with steroids. And that's yeterli. That's all.